There are now 20,721 active cases in Alberta. That is the second most number of active cases since this pandemic began.
Amidst the high of vaccinations, a sobering stat from Alberta's top doctor that shows that while vaccines remain a part of the plan to get us through this pandemic, Albertans still need to follow public health restrictions.
The virus is spreading through all of us, and the many in-person get-togethers, meetups, and other interactions that we have with other people every day.
And Dr. Hinshaw not saying if any additional measures will be added, even as Alberta flirts with surpassing the peak of the second wave. Today, the province announcing 1,539 new cases from roughly 13,700 tests for a positivity rate of 11.4%. 812 new cases of variants of concern were identified, variants now making up 63% of active cases. The R value across the province last week, 1.04. It's 0.98 in the Calgary zone. Hospitalizations are up by 20 to 635, with 143 people in the ICU. 7 new deaths have been reported, and Dr. Hinshaw says 14 deaths that had previously been noted as COVID deaths have now been ruled otherwise. 1.46 million doses of the vaccine have been administered, 30,000 yesterday. And while there is high demand for the vaccine, so too for COVID testing.
We will shift back to offering just one test for all close contacts when they have no symptoms. Starting today, close contacts will be offered testing as soon as they are identified. If they experience symptoms at any point after that first test, they can get tested again. Otherwise, they must remain in quarantine until 14 days have passed, and as of today are no longer requested to have a second test.